This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be discussing bone cancer in dogs. What it is, how we go about diagnosing it, along with some natural remedies that you can consider using at home. Hello you guys, welcome back to my channel. For those of you who are new in today's video, welcome. I'm outside now in part because it's springtime. I'm just so happy to actually see some green grass, which you guys can see behind me. I just wanted to show you how things have changed. For the last time I was outside, we were all covered in snow. Osteosarcoma or bone cancer. First of all, I want to do is discuss a little bit about how we would go about diagnosing it, suspecting if a dog has it or not in veterinary practice. And then go on to discuss some of the conventional and some of the natural remedies. So I've got Pippi here. She's potentially could be an example of a dog. You know, she's still fairly young, doesn't have any serious conditions. But it seems to occur much more common, this osteosarcoma or bone cancer, in our medium to large breed dogs. You know, she's a medium breed dog. Typically, you know, a client will be coming into the veterinary practice with the history of their dog limping. Usually it's progressive. This progressive lameness, it seems to get worse. And many clients, not all, but many would actually notice some type of swelling. So for the majority of dogs that we saw in veterinary practice, they'd be these medium to large breed dogs. And there would be, it'd be obviously pain, they'd be limping on one of the legs. And more importantly in that, you'd actually see this sort of swelling and or pain, often just at the end of one of the long bones. So if we take, for instance here, good girl, Pippi. If we take, for instance here, right along the top of her front leg, right here along her radius, for instance, it wouldn't be uncommon to have a swelling just above that wrist, sort of the end of the radius. And, you know, if she were to come in, she's been limping for a few months, I could see it visibly swollen, and I palpate it and it's fairly painful, you know, give me a pretty big indicator. That's what I'd be concerned about. Is there bone cancer? So it wasn't uncommon, for instance, to see it at the end of the long bones. It could be in the front legs, and for whatever reason, often in these rear legs, and often, you know, right up here in the end of the femur. Once again, you know, you're going to palpate your dog. So the steps you go about it would be first, you know, if you got your dog who's got a history of lameness, and in any case, regardless of why they're lame, you're doing a basic physical exam. We're trying to figure out, like, why, you know, why is your dog sore? What's making him or her uncomfortable? Then nextly, we're sort of isolating what leg are they lame on. You're watching them walk around. You've got a pretty clear example. My dog's holding up her left fore as an example here, Pippi. We're just going to show you as a little example. And then I'm going to palpate what area is sorest on it. And if I see it swollen, and if I'm going to see a swelling there at the end of a long bone, that's when big warning bell goes off. Possibly this could be osteosarcoma or bone cancer. Some of the next steps you'd take in veterinary practice. So first of all, you suspect that, you see that, obviously go seeing your veterinarian. Good girl, Pippi. Oh yes, Pippi. Yes, a good girl. Oh. The next steps you'd be taking, or what would happen in veterinary practice, is they'd be looking at giving your dog an x-ray. For majority of dogs, x-rays itself are pretty diagnostic. And what I want you to do now is just look up here in the corner of this video, and I've actually got a picture of an x-ray of a dog that has osteosarcoma or bone cancer. And what you see on it is pretty classic in terms of of what you see in an x-ray. You see bone loss, where the bone has been eaten away, and often there's sort of this new bone around the outside of that lesion, and that's a pretty classic appearance that you're going to see on x-ray. Additional steps can be taken in terms of, you know, some type of bone biopsy to confirm it. You also want to follow up with just sort of a good basic blood panel to see if any of the organs are affected. But typically, you know, just the x-ray alone is going to give you diagnoses. If your veterinarian is not sure, they can, by all means, just take a digital picture and send that off to a referral clinic or a specialist and have them interpret it for them. Unfortunately, with osteosarcoma, by the time we diagnose it, it's been already spread. More often than not, it's spreading into the lungs. The next other thing that's always advised is to also do an x-ray of the lungs, because if you're visibly seeing cancerous changes, then you know it's quite advanced. But that's sort of one of the markers. And then when it's being discussed around, is your dog a candidate for radiation therapy, which there would be in most cases, it can help shrink the size of that tumor. Unfortunately, it won't eliminate it. Definitely provide some good pain relief. And then as well to some of the conventional options around chemotherapy. Primarily this drug called adriamycin or doxorubicin, along with another drug called cisplatin. A couple big points around radiation therapy, chemotherapy. Unfortunately, we can't cure your dog. So typically, veterinary-wise, and I had seen unfortunately many dogs with bone cancer. The biggest first thing is, we've done that workup, we've done the X-rays. We may or may not have seen, changes in the lungs. So then the next, big discussion is one, what are we going to do next? So what are your options? Well, first of all, obviously, can we remove that limb? So we remove the affected limbs. We're actually going to take that tumor off of your dog. Well, you as the owner are knowing full well that it has already spread to the lungs, potentially somewhere else within the body. Because knowing that we're going to give your dog some instant pain relief, and we're going to give your dog hopefully a good quality of life for a period of time, but we're not going to get a cure. They say typically, the average dog that has just an amputation, they're going to live about 6 months. They say if you do a dog with an amputation in combination with combination chemotherapy, so that adriamycin, cisplatin, they can live an average somewhere between 1 to 2 years. They're saying about 50% of the dogs will live up to a year, up to approximately 25% will live up to 2 years. But it's a real personal decision in terms of, do you go ahead and do that big surgery? Do you have your dog's leg amputated? Do you go down that conventional path? As I said, I had done many amputations. You'd be surprised how well the dogs do after. Dogs are just so adaptable, which is awesome. So the dogs I generally found in practice that did really well are someone like these medium-sized dogs like Pippi. They would adapt so well with just 3 legs. There's many different dogs. You guys have all seen three-legged dogs running around. I'm just surprised how well they do adapt, getting along so well on 3 legs. Obviously, it's harder the larger you are, and if you've got another leg, say it's got arthritis, it's going to have more effect on your dog. So you really need to have that discussion, with your family, with your veterinarian, the pros and cons. What are you going to do next? Do you do nothing? Do you go full on as far as surgery, radiation therapy, chemotherapy, or do you try some of the alternative options? Regardless of whatever you choose to do or whichever path you're choosing to go down, the first big thing is really giving your dog adequate pain control. Bone cancer is especially painful, and so that can be a combination of conventional and holistic treatments. Conventionally, you're going to be looking at some of the non-steroidal anti-inflammatory drugs, such as this one. And this is a meloxicam. We were giving it I like meloxicam. I seem to feel that I have the least number of side effects from it. And it's also nice, you can get it as an oral liquid. Most guys accept it really well. Also look at some of the narcotics, such as tramadol. There's another sort of pain modulating drug called gabapentin, which has been used for people for nerve-related pain. And lots of the dogs respond well to it, and it's got minimal side effects. So those are kind of 3 or 4 big conventional veterinary medications you'd want to think of. And then also consider some of the natural pain remedies. Such as things like this one here, this boswellia. If you're looking at the boswellia dose, we're looking at 10 to 20 milligrams per 10 pounds of body weight daily. So somewhere like Pippi, she gives up somewhere between 50 to 100 milligrams of boswellia a day. As well too, curcumin, which I'm going to be discussing also as a remedy for bone cancer, but it's also a really good anti-inflammatory and will give some natural pain relief. Now that you've got the sort of pain under control, the next big thing is, a combination of different remedies I want to discuss naturally. We'll go roll Pippi. So the first big thing is looking at your dog's diet. in particular looking at following the canine cancer diet. So I'll put a link in a description under this video. But primarily what we're looking at doing is eliminating the things that feed the cancer, which essentially are the simple carbohydrates, things that are rapidly broken down, and looking at stuff that's going to potentially not feed the cancer cells. So that would be a combination of protein and or the fats. So really, you know, you're looking at some type of Atkins type diet that you're feeding your dog. So that could be something, so what it means, you know, most of the kibbles that you're gonna have out there, you know, such as this kibble here, it's a kibble because it's got carbohydrates binding to it. That's what turns it into a kibble. So you're not gonna be feeding kibble, you're eliminating that. So this here is a sausage, of which Pippi seems to really like. And that would also work. I mean, there it is, right? It's just fat, protein, and Pippi likes it. All right. The next thing, essential fatty acids. That can be in the form of fish oil. It can be in the form of flax oil, which I have here. The big thing is you need to be looking at these high therapeutic doses. So we're looking at 1,000 milligrams per 10 pounds of body weight twice daily. So it's quite high, especially when we're dealing with, you know, aggressive type of cancer. So if we're looking at the flax oil, it's 1 tablespoon per 50 pounds of body weight. The next supplement I want to look at having you give is the curcumin, which I have here. And a couple points about the curcumin. First of all, preferably get it in a capsule formation, such as this, because it stains everything orange. You can get it up to 400 to 500 milligrams in a capsule. A therapeutic dog dose is 100 milligrams per 10 pounds of body weight. Once again, if you're looking at something like an aggressive cancer, I would be giving it twice daily. So like Pippi, she'd be getting 400 to 500 milligrams twice a day. And as you saw how she ate the sausage, I know she'd happily eat the curcumin. Not every dog will, so you may have to disguise it and some of that new food, say the hamburger that you're mixing up. The other point is you want to make sure you're giving the curcumin with fat, but preferably with foods. You want your dog to eat, and then so much more of it is absorbed. Next, I want you to consider some type of mixed bioflavonoid supplement. So the flavonoids are, you know, you take a vegetable, just a second. There are specific nutrients in that peel called flavonoids, which have some wonderful therapeutic properties. So one of them, for instance, you know, is within the orange peel, such as rutin. There's also, you know, other ingredients such as within our apple peel, quercetin. There's flavonoids in green tea called ECGC. A number of different flavonoids. So I've got here here's a mixed bioflavonoid supplement. I need to get some glasses so I could read this thing. So this product, the Citro Bioflavonoid Capsule Supplement, is recommending 2 capsules a day. That's for an average 150-pound person. So we're just dosing it accordingly, knowing full well that they're also very safe in terms of a supplement. You know, so a dog, you know, approximately Pippi size, she'd be getting about a capsule a day. I would have you consider the immune supportive mushrooms, such as reishi, maitake, cordyceps. A number of those have some known therapeutic benefits, in particular for some of the more aggressive type cancers, such as seen in osteosarcoma. This is a combination supplement called Immune 7, which contains a number of the different therapeutic mushrooms, such as shiitake, maitake, reishi, cordyceps, sun mushroom. Do we know for sure which one is going to be more beneficial? No, we don't. Are there a number of different mushrooms we know have specific immune stimulating benefits? Yes, we do. That may stimulate your dog's own immune system to start to attack those cancer cells more effectively. So we're looking at sort of, once again, the dose varies. I mean, this is typically saying, it says 1 to 3 capsules per day. An average would be 2 capsules, 1 twice a day for an average person. You're just going to dose your dog accordingly again. Yeah, so a dog like Pippi, she would also then be getting one of these once a day. The last thing I wanted to show you guys was using dandelion root as sort of the last remedy I want to discuss. So I actually went out into the garden. I picked myself some dandelion, which is here. So, yeah, it's springtime. We now have dandelions growing. You guys probably have those in your backyard. Here's some of the root. And then what I've done, just make myself some tea. I'm just gonna show you. Here's the tea there. See the kind of brownish looking. Very simmered for about 20 minutes. So I've discussed dandelion root in the past. In particular, this University of Windsor study where they're actually they're isolating some of the specific compounds that are in dandelion root because they've seen such great results using dandelion root for some of these non-responsive types of cancers. So personally, I used it on Lewis. Unfortunately, I think it was too late by the time he was diagnosed. And, cancer is a real hard thing to treat. There's no guarantee you're going to give these things and you're going to put your dog's cancer into remission or cure that cancer. But definitely they're all worth trying. And yeah, I'm a real big advocate of that. So, a couple different options. One, you can just do what I did, boil up the dandelion root, make a tea. Really, I put about a cup of water, and I probably put in 2 tablespoons of chopped up dandelion root. I let that simmer for about 15 minutes. You can let it cool down. And a pretty sort of standard dose, 1 to 2 tablespoons per 10 pounds of body weight. I'd be wanting giving that twice daily. You can also actually buy the dandelion root as a tea, which I've had in the past. It's a real obviously easier way for you guys to do it and give it. And then which would be a similar dose, about a tablespoon per 10 pounds of body weight twice daily. And then the last thing would be actually to get a dandelion root and leaf combination tincture, which I have here. This is a combination of the root and the leaf. Majority of the dandelion tinctures are primarily the root. And when you're looking at sort of a pretty average tincture dose, we're looking for somewhere like about a half a mil or half a dropper full, which is about there. So that's about half a dropper full for 20 pounds of body weight. And I'd be giving that twice daily. So Pippi would be getting, 2 of those, or close to a mil. I'll be giving her about a mil twice daily of the tincture. So thanks you guys once again for watching this edition of Veterinary Secrets. Thanks Pippi for partaking. She's definitely a good sport about it. And she's a great little model dog.